regularly. As mothers, we're expected to be superwomen, People don't even remember to check on some mothers or some ladies to say, oh, how are you doing? How are you feeling? People don't get to hear that regularly. And I am so glad that it is something that we'll be talking about today. So thank you so much, Ma. Thank you so much, Ma. So in a few minutes, we're going to be introducing the first speaker. But please, just for this time, if you have any question, please feel free to put them in the chat. We'll have a time to share, to ask questions and answer, to interact. So if you have anything that is already boiling in your heart to talk about, please put it in the chat and we would talk about it. Thank you so much. So if the first speaker, Dr. Seyi Olaye, please get ready. We're going to introduce you soon, Ma. We're going to introduce you in few seconds.
Okay. Thank you so much. Thank you. I just checked with Josie. Josie, please check your WhatsApp for me. Thank you very much.
Thank you, ladies. Thank you so much. So now we are going to introduce our first speaker. Our first speaker, Dr. Seyi Olaye. I'm sorry if I'm not pronouncing it properly, Dr. Seyi. Dr. Seyi Olaye is a medical doctor who is passionate about health and well-being, most especially the mental health of an individual. Over the years, she has and still volunteers at various NGOs, such as True Women Foundation. She has 8 years experience in hospital management. Dr. Seyi Olaye is a graduate of Vice Medical University in Belarus and with her MBBS. And she completed her internship in Belmapo, Belarus. She is a teacher and she is also an interior decorator. She loves passing knowledge to others, which we're going to be benefiting from today. She is a woman who has passion for the things of God. In life, she believes with the right tools, anything is possible. Please join me as we welcome Dr. Seyi Olaye to the platform. Thank you.
Good afternoon, everyone.
Good afternoon.
Good afternoon. I don't know if we can we all hear me properly? Can we all see me properly?
Please send us some responses, some reactions in the chat if you can hear Dr. Seyi, please. And please do throughout the session, please don't forget to put in your questions, please. It is a positive platform, but we want you to be yourself and to enjoy the moment. Thank you. Thank you.
Okay. So, yes, okay. So I can see that we can hear me. Yes, we can see me. Thank you for having me here today. I'm so grateful to be here today. And I really like the theme and I really like the atmosphere here today. And I hope I'll be able to share something, one or two things with you. And hopefully you would go away stronger with additional knowledge that maybe you didn't have before, or just like getting more knowledge on what you already had before in mind. So we're going to be talking about how are you theme, and as I think it was Josephine, the co-host, said that a lot of times people don't really ask how a person is, and most of the times if we're even asking how are you, we're just asking it like in passing. So we're just like, how are you? And then we too in turn, we always say, I'm fine, thank you, and that's all, even if we're not feeling fine really deep inside. And as I'm going to talking about all this topic in a medical way. So we're bringing it from a medical approach. I'm guessing some other people will talk about it from other areas. So I'll be sharing my screen. It says only the host can share it. Is there something that can be done about that?
What's that? The sharing of the screen?
Yes, please.
You should be able to share. Right. All right. Should we make you host for now? So you can share?
Maybe.
I think we should just make you host, because I can't go into the, if I go back to the platform, the main profile, I might just mess everything. I just go back into, okay, let me, please,
Okay, so while that is going on, I might as well just start talking until it's sorted out.
I don't know
so,
if I can,
like I said, I'm going to be
a co-host, so maybe that would help.
Let's try it out. And let's
Try
see.
that.
Okay, let me try. Yes, it worked. Thank you very much.
You're welcome.
Okay, so can everyone tell me if you can see my screen?
Yes, we can.
It's okay. So, like I said, I'm coming with the approach, with the medical approach. How are you? Like with the topic, how are you? I'm going to be talking about your mind and how your mind is connected to your heart, how your mental state is connected to your heart. So a lot of times we always think, okay, our mind is separate from our heart. I'm sure we've heard the definition of what health is. Like, having good health is not just the absence of, it is not just the absence of physical disease. It is also the absence of mental problems.
All right. Please, could you mute your mic? Who is that?
Please,
could you mute your mic, please? Yes. Thank you. Whoever is in the background, please mute your mic. Thank you. Thank you so much. Yes. Thank you. Dr. Seyi, please continue.
Sorry, can we still hear me?
Yes, we can. Thank you.
So, like I was saying, having good health is the absence of both physical and mental illness. It's not just about the physical body, it's also about your mind. We need to understand that our mind is actually closely related to our body. And this time we're specifically talking about our heart. So I'm going to be dealing with that. As you can see on the slide, I put the first thing we're going to be talking about is the heart. The second thing is the link between the heart and the mental health. And then I would choose just one more system in the body to talk about that could be affected by our mind, the state of our health, our mental health. And then briefly, I might talk about somatic diseases and what we can do about it. So the first thing is our hearts. We've talked about. This is a faith-based platform. So even in the Bible, when we're talking about emotions and actions, if you see it from a logical point, it's actually your brain that does all those, that processes thoughts and processes your actions. If someone has a problem in their brain, you see that they could have changes in their body and all those things. But why is it that the Bible would use the heart as an expression? Even us as human beings, being religious, we always use our hearts to say your heart is broken and all those things. It's your emotions, it's your thoughts, it's your mind inside of you and your brain that controls those parts. So why do we say our hearts? It just goes to show us that your heart is very relevant and very closely related to your mind. We know our heart is a vital organ. It pumps blood all over our body and it gives oxygen to to the body and gets nutrients and then takes back the carbon dioxide that we don't need so that it could be expelled out of the body. So imagine if there is something wrong with your heart. That provides the oxygen that will be delivered to your brain that would help you to and to operate properly. So there's such a close relationship between your heart and your mind. When we go through emotions, we say our heart hurts. When we have anxiety or stress, we feel it in our hearts. You can feel it immediately in your heart. If you're running now really fast, you go and then you're stressed, or if you're stressed or you're under so much anxiety or you feel so down, you might start feeling your heart beating so fast. You hear that boom, 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 boom. And we call it palpitations medically. This is your heart's response. How does this relate to your mind? You see, like with them, there's something called the flight and fight response. And it is something that I remember they've taught us since maybe in biology when we were younger, that we are programmed when we have stressors around to either fight or run away, which is flight. And what that does is that it brings forth, it releases some hormones in our body. These hormones are called adrenaline and cortisol. And these hormones will cause some changes in our body, maybe reduce some things, some functions, increase. And this is not supposed to be the norm for the body. So now, if someone has anxiety or depression, anxiety disorder specifically, and or depression, this person is in a constant state or constantly feels this flight and fight response going on. So this flight and flight response, you'd be able to confirm with me that when you're under stress and all of that, you can feel your heart working harder than it should, because it's trying to pump blood around so that you can have the energy to do all those things that you're supposed to do. This is the fight and flight response. So if the person is having it constantly, your heart is working constantly. You would hear the person start having hypertension. You would hear that it will increase the risk of heart disease. It can cause hypertension and so many different things. And you see that the world, we're having more and more problems. There's so much rumors of war. There's so much things going on around. People are stressed. People are going through mental problems. And this in turn is reflecting in the fact that the number one cause of death is actually heart disease. A lot of people have heart disease. A lot of people have hypertension, especially in older ages. You will hardly find anyone as a doctor, you ask, do you have hypertension? It's one of the questions we always ask, especially if they're 40, because a lot of people actually have heart disease. A lot of people have hypertension because of stress, constant stress. The other thing is, in the flip side, if you have heart attack or heart surgery, you are more likely after that to actually start suffering from anxiety and depression. So there's such a close relationship between the two of them. So I would like to talk about anxiety first of all. So anxiety is what we would commonly say is like when you feel worry and you're stressed without any reason. You just have this exaggerated reaction. Maybe someone just comes to you and taps you and it's like everything. You're just always in a panic state, constantly stressed, constantly in a panic state. And it could continue even after the stressful event has happened. You could still continually feel the symptoms. So the symptoms, you can have panic attacks, you can have hot and cold flushes, so you just feel hot in your body or you feel cold in your body, your heart starts racing, you can feel your heart pumping, you can feel it beating, you have tightening in your chest, you have shortness of breath. All these things just accumulate, and this is what we would call an anxiety disorder. And it's so much more than what we make it, because a lot of times we trivialize these issues. We just think, oh, maybe this person is just exaggerating. Maybe this person is just faking it. His mental health diseases actually do exist. And I like the fact that in the world as a whole, we're beginning to recognize it more. I come from an African country, and here, even though they're getting a bit better, it's like there's a stigma behind someone having mental health issue. People don't treat it like they would treat physical health, because if having good health is both mental and physical wellness, then we should also treat mental illnesses too. We shouldn't just push it to the side. Another thing is depression. Depression, when we talk about low mood, it's not just when you feel low. A lot of people over use this depression and be like, oh, I feel depressed. Depression is much more than just having low mood. It's like an intense feeling of lowness. You feel it for a long period of time, and sometimes there's not even a cause. There's no reason in which you feel low. You just feel so low, and you feel like you lose interest. So as you can see, some of the symptoms I listed here, you lose interest in things, you withdraw, you have an inability to concentrate, you feel overwhelmed. Maybe there's change height, weight, it could affect the person's weight, it could affect the person's sleep, a person becomes moody, negative thoughts. And on the flip side, some people have depression and they don't actually behave in the same way that you would expect them to. So you would hear of like some comedians who seemed so bright everywhere they went to, and they actually had depression. So sometimes you might notice someone around you who used to be so calm starting to have so much energy, more energy than they had before. They would start cracking jokes and stuff like that, and you're like, this person is usually a lot brighter, a lot sharper than they used to be before. This could be a way of a person demonstrating a depression, because what happens to those people is when they go back inside, they would be so sad. That is, it will feel like the whole world has come upon them. Depression can lead people to find it so hard to do normal, regular, everyday tasks. It can make them excessively. So you see someone who's sleeping excessively, who is so lazy. They can even find it so hard just to have their bath, to leave the house. And so if you just look at it from normal human point of view, like, oh, this person is so lazy. This person is just so demotivated. You don't know what is wrong with this person. You don't know that the person through mental struggles. This person actually needs help. And so when they start having suicidal thoughts, we would take more intense measures. Some people need to be under drugs. Some people need to actually be put in a home, in admitted, because they could cause harm to themselves. All of those things. So these things are so important. And how does it affect your heart? Heart, like I said before, because it will cause stress on your heart. It causes those release of hormones. Those things affect your heart, can cause coronary heart disease, can cause, you hear of people having heart attack. I think there was this story of a man, a politician, was watching the football match. There was recently the African Cup, and because of the tension, person probably already had like heart problems, maybe a heart disease, maybe hypertension. And so during this, because of the stress of it, you see, this is like the mental state. The person had the heart attack and died. Is that important? The correlation, the constant stress on the heart, the constant stress of the heart can lead to this. This could also be connected to stroke. And at the same time, these heart diseases, when you have a disease for a long time, for a protracted period of time, it can also cause this same anxiety, depression, and other mental illnesses to occur. So it's almost like a vicious cycle. One causes the other causes the other causes. So how do we stop this? That's the problem. How can we stop this? How can we move forward? So before I talk about how we can treat this, we would talk briefly about another system that could be affected, and that is the digestive system. I don't know if you've ever been in a situation where you're feeling so stressed and it causes you to start, it causes your stomach to start rumbling and turning, and then you have to go use the toilet, or because of your stress, you don't even have appetite at all. And you just think, oh, it's normal. It's because of the connection between your head, your brain, and your stomach. So as you're having those mental, as you're having those thoughts, you're causing your brain, you're sending some signals, your brain is now sending signals also down, because there's this autonomic system, nervous system. It's also going to affect your stomach. It causes people diarrhea, bloating, constipation, pain in the stomach, especially people who have this condition called irritable bowel syndrome, in which their bowels are easily irritated. So like little stresses can cause them to start having episodes of these different symptoms that I said. And research has shown that using antidepressants that's meant to be for depression can actually help to reduce the symptoms felt by people with IBS, which is irritable bowel syndrome. Just to emphasize how much your mind, the state of your mind, the brain, and all of that affects other organs in your body. So let's move on to what we should do. Like I said, your heart is one of the number one organs that is affected by the state of your mind. And when your heart is affected, that affects the whole of your body. If I should talk about it, we will spend the whole day talking about how the heart can affect the kidney, can affect, because it's bringing blood, it's bringing nutrients, it's doing everything to your whole body, including your brain. So how can we combat all of this? You should rest. We should take time to rest. Too many people working there's not even 9 to 5 no more. You're working 12 hours, or you're working even more than 12 hours. You're sleeping 4 hours in a day. You hardly have time for yourself. You don't take care of yourself. You just do anything, you eat anyhow. Everything is just it's all a mess. Sometimes you just have to take a step back and rest. It's that simple. A lot of people will come to the hospital thinking that they have some other kind of illness, and it's actually just because they're going to stress. Stress will also cause reduction in your immune system and increase your chances of getting other diseases. So all you need to do, first of all, is to rest. Go on trips, even if it just means to go to someone's house for just a few days. Just the change of environment helps you. Even if it's in the same city that you're in, go on trips, go on vacations, treat yourself, pamper yourself. In where I studied, which is in Belarus, what they do sometimes is they go to spa. It's part of the treatment regime. If you go to the medical doctor, they will tell you, or you go to something they call sanatorium, which is like a spa. Just go and relax. And the people actually get better from doing that. Try and remove the stresses around you. If you're working so many jobs, try and reduce it. Try and reduce your expenses if you can. Try and get help. Try and tell people around you if they're the ones stressing you. Try and explain to them. Try to get help from people also. I need you to help me with this. Stop trying to do everything all by yourself. If we actually communicate with people that are going through struggles, when they ask you how you are, there is nothing wrong in actually telling people, this is how I feel. And we also, when people tell us this is how they feel, we should also be receptive to be able to say, oh, is this how you feel? Don't ridicule people. Don't say, oh, you are not strong enough. That is the reason why a lot of people don't open up about what they're going through. That's the reason why every time it is, I'm fine, thank you. And you too, I'm fine. We move on. In Russia, which is like where I studied, they would, if a person asks you how you are, they actually want you to answer and say, oh, this happened and that happened. And I think that's a really good mentality. So they really want you to talk about what's actually going on in your life, how you actually are. So for me, when I ask people, how are you? I actually mean, what's going on in your life? How do you actually feel right now? It feels like you're not in a good place. What's going on? And then if it's really bad, you can see that it's because it can affect your daily life, it can affect your relationships, it can affect your job, your work. Go and seek professional help. There is so many platforms. You can even get help online. You can get psychologists and counselors online. Even in churches, you can get it online. You can even look for options according to your preferences. People that maybe are specialists in women and this and that. You can specifically look for people that would cater for your needs. So in all, I hope you learned something from my talk today. And I hope you were blessed. And when the question and answer session starts, I think you would be able to ask me questions if you have any questions regarding what I talked about. But for now, that's the end of my session. Thank you very much for having me once again. I'm so pleased and blessed to be here. Thank you, ma'am.
Thank you so much, Dr. Seyi. We really, really appreciate you. Thank you for that wonderful, wonderful talk that you've just done. Thank you so much.
Thank you, ma'am.
Thank you so much. So once again, everyone, please, please, please feel free to put in the chats. Please put in the chats your questions. I've got loads of questions from your expectations for tonight, and we're going to go through all that. We have a session for all that. So we are going to go through all that. There's a lot of questions, so many. So please put your questions in the chat and keep yourself muted. We're going to go through the speakers and then we'd have the questions and answers. But if there's anything that is really, a burning question in your heart, I already have questions for you, Seyi. So I've put it, I've sent it around. So, but please put your questions in the chat. We'll go to the next session. Josephine, please introduce Dr. Apostle Precious too. Was it my session? I think it's my session. Sorry, I think it's my session. So over to you, Josie.
Okay, thank you. Thank you so much. Thank you so much, Dr. Seyi. That was very, very informative. Thank you. I've learned so much today. And, talking about fight or flight response, like actually when somebody asks, oh, how are you doing? My first response is usually, I'm fine. Even though I'm not fine, even though there are lots of things going on in my mind, in my head, the first thing I'll say is I'm fine. So it would take somebody to go further. Oh, how are you doing today? Oh, what did you do yesterday? What have you done? It will take a more conversation that will get me to, okay, this is how I'm feeling. This is what I'm going through, So as ladies, it is very, very important for us to know how to approach fellow ladies, especially when they say they're fine and we can really see that, no, this person is not fine, to know how to get information from people. Thank you so much. Thank you so much, Doctor. So the next speaker I will be introducing will be Dr. Apostle Precious Toll. Lady Apostle Dr. Precious Toll, she is the founder and CEO of the Rising Star Daycare Limited. She is the founder and CEO of Women Worship Gospel Music Awards, the founder and CEO of Albinism Foundation UK and Liberia. She's the founder and CEO of Restored to Ignite Ministry